Hepatic encephalopathy is a neuropsychiatric syndrome caused by an underlying liver disease. The pathophysiology behind it is that due to decrease in the function of the liver, there is increased amount of circulating neurotoxins that are normally metabolized by the liver. There are different theories regarding which neurotoxins are responsible. The main culprit is ammonia and its compounds. Other research also said that GABA, along with octapamine, amino acids, and mercaptans and fatty acids, can also act as neurotransmitters. Regarding this, you have to remember that in an underlying liver disease, there are certain factors which can precipitate the hepatic encephalopathy, resulting in the acute episodes like with drugs like sedatives and antidepressants, an episode of dehydration, and there could also be use of diuretics and paracentesis, photosystemic shunting in chronic liver disease, some infection, hypokalemia, constipation. There could also be increase in the protein load like a diet which was rich in protein, and also gastrointestinal bleeding. The clinical features also include the flapping tremor, that is asterixis, also called the liver flap. Fetor hepaticus, a sweet musty odor, is also present. Depending depending upon the clinical features, it can be graded into 4 grades. In the early phase, there is poor inability to concentrate, slurring of speech, slow mentation, and disordered sleep rhythm. Along with the period of time, the symptoms are going to worsen. At the end stage, there is apathy, that is unresponsiveness to different stimuli like voice. The patient may or may not respond to painful stimuli, and he could be unconscious, that is coma. The differentials of hepatic encephalopathy should be ruled out. These include intracranial bleed resulting in subdural, extradural hematoma. There could be drug or alcohol intoxication. Other neuropsychiatric disorders like delirium tremens and alcohol withdrawal symptoms, Wernicke's encephalopathy, primary psychiatric disorders, hypoglycemia or an acute hypoglycemic episode, neurological effects of Wilson's disease, and post-ictal state. After a seizure, the patient can have these effects. The investigation includes the electroencephalogram. In the electroencephalogram, it shows diffuse slowing of the normal alpha waves with eventual development of the delta waves. The management depends upon the prevention. We have to first remove the precipitating causes, and then some drugs can also be used like lactulose. It has many effects like an osmotic laxatic effect, and it also reduces the pH of the colonic content, which limits the colonic ammonia absorption and promotes incorporation of nitrogen into bacteria. Second drug could be used is the rifamycin. The definitive treatment is the treatment of the underlying cause, and if it is late stage of cirrhosis, the definite treatment is the liver transplantation.